Hi, this is Cindy from Dr. Cromeyer's office, and this is our first installment on Insurance 101, talking about how insurance works in dental offices. There are different kinds of insurance, and feel free to ask any questions that you have about insurance. One is called indemnity, and that's where you pay part of the premium and someone else may pay part of the premium, like an employer. And then you have co-pays. The insurance pays a percentage of what your procedures cost, and the patient portion is whatever the insurance doesn't cover. Most of the time we can estimate that for you pretty accurately. There are also other kinds of insurances too. So there's indemnity, there's PPOs, there's premier plans, and there are HMOs. And HMOs require you to go to an in-network dentist, one that you are assigned to. PPOs generally let you choose your own dentist with a few exceptions. Those are a higher quality plan than the HMO. And PPOs are preferred provider organizations. And they usually have some type of an agreement with the dental office to reduce their fees in order to see their patients or their insureds. And then there's premier plans, and those are plans where those are the highest quality plans where you can choose your own insurance, you can choose your own dentist, you usually have higher maxes. You usually have the insurance paying a higher percentage. And what I mean by you can choose your own insurances is sometimes there are different choices in those type of plans. Most plans have maximums of $1,000 or $1,500, sometimes $2,000, and everything that you have done during the year comes out of that maximum. That's cleanings, any fillings, everything comes out of that maximum. And then when you hit that top max, which is $1,000 or $15, whatever your plan is, they will not pay any more after that. Let's see, when you're choosing your dental plans, usually you have choices through an employer. And usually the most expensive plan is going to be the best plan for you. And usually you can choose these plans during open season, which usually takes place between September and December every year. And then that new plan takes effect as of January 1st the following year. There's another way to choose a dental plan, and that's online or through Covered California. We are in the Sacramento, California area, so we may have different coverage options for people than people in other areas of the country. We have a high percentage of state workers in Sacramento, California, and state workers have some different options. They also have an open season for 2 weeks in September. One of their options, and one that they are required to have for the first 2 years of employment with the state, is an HMO plan. It's called Delta Care. And you're forced to serve out that sentence of 2 years with a Delta Care plan, and then you can choose a different type of insurance coverage, whether it be Delta PPO or Delta Premier. We recommend the Delta Premier. It's about $10 more per month for the insureds. However, it gives you a much higher quality of coverage, and you also have the option of choosing higher quality dentists. And what makes a higher quality dentist? That is materials that are used that are very high quality, such as the ones that we use here. We don't buy our products from cheapo companies. We buy the top of the line products because we want to put in our patients' mouths the highest quality filling material or crown material. We also, well, let me finish talking though about the HMOs and waiting periods. And when you're choosing your dental plans, you want to make sure that you can choose your own dentist and that you aren't limited to a small group of dentists on a list, or that you aren't assigned to a dentist. We have a question from Micah. Good question. What if I don't like my insurance? there are things that you can do if you don't like your insurance. If your insurance is given to you by an employer, you and a group of your closest friends can go to your HR department and let them know that you aren't happy with your plan. Let them know that perhaps they don't cover fluoride, or perhaps they don't cover white fillings on back teeth. Many insurance plans still downgrade white fillings to what they would have paid if it was a silver filling. And to me, that is a low quality plan. I would go to my HR department and let them know, yeah, my 80% coverage does not cover 80% of my fillings, because they are downgrading the white fillings to the silver price. And maybe when they look for their plans at their next renewal date, they can include a plan, might have a bigger copayment, who knows, that will include white fillings. We do not place silver fillings anymore in our office, with very specific exceptions, because silver fillings expand and contract, and over time what we've noticed is that they can actually crack a tooth. They allow redecay in those teeth. And there are other concerns too with silver fillings. So we have chosen not to do silver fillings and just place white fillings for the most part. Let's see, we have another question. I think it was, does my insurance carry over to the following year? It does not carry over to the following year. Your insurance is usually for one period of time, which might be from January to December. December 31st. And then on January 1st, the new plan starts. And the new plan would have the new maximum. So any maximum that you didn't use in the prior year with last year's insurance is completely lost. It just goes back in the pocket of the insurance company. So we recommend that you utilize your insurance if you have any treatment that needs to be done. Here's another question from one of my favorite people. Do you offer additional plans that someone can purchase to help cover additional costs? We don't have additional plans unless you want to purchase something online, such as at ehealthinsurance.com or Covered California. And some of those plans don't work with other plans that you may already have existing. So it's kind of a tricky area there. If you decide that you want to go that route, give us a call or email me, Cindy@CromeyersDental.com. We can help you with that, and we can let you know whether this is a plan that's actually going to help you or if you're just wasting your money. We do have an in-office plan, however, if you don't have insurance coverage at all. And most good insurance plans are going to cost about $100 a month. And the ones that we can offer in-house or through our own in-office membership plan, I believe it's $35 or $40 a month, and it pays for 2 cleanings a year per person, a couple of emergency visits, and there are other benefits to these plans as well. We also have one for our patients that have perio. Perio disease is prevalent, and we encourage our perio patients to be seen usually every 3 to 4 months, and that's customized per person for your own needs. And we also have a membership plan for our perio patients as well. Let's see. The state workers dental plan, I did want to go into that a little bit more. So I had said previously that for the first 2 years they only offer the Delta Care HMO. After those 2 years, we would advise you to choose the Delta Premier plan. And the Delta Premier, it gives you some of the most consistent, high quality dental offerings that you can possibly get in the Sacramento area. Also, if you're a married couple and you both worked for the state prior to retirement, when you do retire, you want to still keep your own insurance plan. You don't want to go on your spouse's insurance plan to save a few bucks. And the reason for that is if you go on your spouse's plan, you actually are covered at a lower amount than the state worker. They have a tiered plan. So you both want to go in to retirement with your own individual dental plan, if possible. And we talked about ehealthinsurance.com and Colored California. What you want to look at in all of these plans is that you are free to choose your own dentist. You don't want anybody telling you who to go to. And Dr. Cromeyer is extremely concerned about health. And in fact, our whole focus and goal is to give you the healthiest smile that you can have. And that doesn't always mean the widest smile or the most teeth. It's whatever is healthy for you. And she's also very conservative. And I also wanted to tell you, she not only sees adults, but she also sees children. And with children, we do recommend that they be seen either when their first tooth comes in their mouth or by 1 year old. And that's so the doctor can make sure that their arches are forming correctly, and that there are some things that we can see early on. And it's also to help our patients learn about how to care for their children's teeth as well. So we see all ages. We have no upper limit, but I would say we see everyone from 6 months to over 100 years old, and we love our patients. Again, Dr. Cromeyer, she's a member of the ADA, the CDA, Sacramento Dental Society. She's highly educated, very conservative. She's patient, thorough, and a great problem solver. Our entire staff is committed to healthy smiles. And when it comes to choices in materials and labs, that's where the choice of your dental office really is important. We order the best materials. There are companies that we could order from that provide some really cheap materials, and that's probably what some offices do in order to be able to see a lot of plans that we don't see here. A lot of the plans cover so little, and I'm talking about insurance plans, they cover so little, and they expect the dentist to honor those really low fees that those offices are not able to afford the high quality materials. And we don't compromise here. If you get a white filling, it's a 3M product, and that's the best. If you get a crown here, we send it to a couple of different labs that only produce very high quality crowns. Let's see. We stay up to date with our dental education courses, and a lot of us have been here since the early 80s. We were with the dentist that used to be here, Dr. Powell, that retired, and now we are very happy to be here with Dr. Cromeyer. Dr. Powell handpicked Dr. Cromeyer to take over for his beloved patients, and that says a lot. She is a stickler for detail, and we're really happy to be here with her. Well, that's about it. I don't see any other questions. Oh, here is one. Can we choose insurance any time of the year? No, there is an open season, and your employer determines when that open season is. And there was one other subject, and that's Denti-Cal. And this is a plan that is offered by the government, and usually it's a welfare type of plan where either they supplement coverage for you, or they just outright give it to you. And we do not take the Denti-Cal plans. The plans that we accept are either through an employer or plans that you have purchased yourself, not the government type of plans. Okay, well, thank you very much for joining. Feel free to send us any questions. We will be doing this again and getting into more detail with specific insurance companies. Thank you for joining.